The following is a paid program that is paid for by AARP of Michigan.
To be vaccinated or not to be vaccinated? That is the question. Not really, but Dr. Bagdasarian will answer your questions about flu season, vaccinations, and everything else that you need to know. Cold and flu season. Vaccinate, not vaccinate. There's no one better to talk about that and answer all of our questions than our own Chief Medical Executive for the state of Michigan, Dr. Bagdasarian. Thank you for being with us today.
Thank you for having me on. I love coming and talking to you on your show.
Well, I think I kind of accosted you when we were somewhere, and I said, will you come on this fall and talk about cold and flu and what vaccinations people should get and what's out there? So thank you for taking the time to do that.
My pleasure.
So before we get into that particular topic, tell our listening audience, what is a Chief Medical Executive for the Health and Human Services for the state of Michigan, and what do you do?
Well, my role is an advisory role, so I advise the governor and I advise the director of MDHHS, the Michigan Department of Health and Human Services, on any public health issues. Now, every state has someone like me in a position like this. They call it different things. Some states have a surgeon general. Some states have a chief medical officer. We have a chief medical executive. But my role is to really put advice out there for the public, for the people who live in Michigan, and give them the best advice possible. So think of me as a doctor for the whole state.
And where do you get the advice that you provide? Where do you get that advice from?
Well, number one, I'm an infectious disease physician, so I'm still practicing, and I still go in and round on patients with infectious disease issues in the hospital every week. I also have every week.
Good
yes.
for you.
I also have a master's degree in epidemiology, which is the study of disease over populations, and that means that I have a skill set that allows me to do research and to really evaluate the research. And so I spend all of my free time looking at studies that are coming out on different topics, like vaccines.
That's fantastic. So you really are not only the state of Michigan expert, but you're a national expert in this area. You've done a lot of work, a lot of research in this area. So what the information that people receive today, they know that it's come from someone who's well credentialed, still does rounds in the hospitals once a week. That's very impressive, and is researching this work all the time. So thank you for that, because I know your job is so demanding. So for you to still have boots on the ground and be right where the live where the action is very impressive. So now that we're entering our cold and flu season, there are people who are questioning, COVID's kind of over, kind of not. What advice would you give? What are you sharing with the Michigan Department of Health and Human Services? What are you sharing with people about what they should be doing?
Well, what I want people to know is that COVID is very much still here and it's still an issue. And when I say I still round in the hospital, just last week I was rounding on a patient in the ICU, the intensive care unit, with COVID. And it is still a disease that is very much around. It's circulating in Michigan and around the country. And it's a disease that still has the potential to put people in the hospital and to put them in the ICU. And really what we want to do is not necessarily prevent every single case of COVID, but we want to give people the tools to really keep themselves safe and protected, meaning I want people to avoid those really severe consequences. I want to keep people out of the hospital, out of emergency rooms, off ventilators, and I want to protect lives and make sure people don't die from things like COVID.
Are you concerned that COVID might have the same type of impact that it had 4 or 5 years ago now, if people don't protect themselves?
Well, one of the things we have seen is with every iteration of the COVID vaccine that's come out, people are becoming a little bit more lax and fewer people are getting immunized. So every year the number of people getting the flu vaccine has declined. This year in particular, there's a lot of controversy and talk about vaccines, and I think that's impacting people's decisions. But I want to be clear, the science hasn't changed. The data hasn't changed. We know that the COVID vaccine, again, keeps people out of the hospital, out of the ER, keeps them out of the ICU, prevents death, and prevents things like long COVID.
And so what about people who are concerned about what it does, the long-term impact? There are folks who say it hasn't been researched enough, it hasn't been around long enough for us to know what's going to happen 5 or 10 years from now. Long COVID is still out there. I often say to them, getting COVID could be worse than all the things that you just described. But what do you say to people who have those concerns?
Well, if we think back to the history of this vaccine, we started giving the vaccine fairly early in the COVID pandemic. So we've had about 5 years to see how people fare, how they do, how they react to the vaccine long term. And what I will tell you is that when you look at any sort of side effects or any consequences of the vaccine, there are, of course, some things you've got to watch out for. You've got to watch out for things like allergic reactions. Some people will get a fever after a vaccine. Some people will feel achy, will feel fatigue. There are some things that can be short term, but we have not found anything that compares to the severe outcomes of the infection itself. We know that the infection itself can, number one, lead to death and disability in the short term, but also can lead to long COVID and people who are living with the consequences of COVID even years after the infection has passed.
Are there different types of COVID, different types of viruses? The initial strain of vaccines may not cover the strain of viruses that are currently.
Yeah, so there's 2 reasons why we recommend getting a COVID vaccination every year, and this is the time to do it. Fall is the time to do it. And those 2 reasons are, number one, there's different variants circulating. So there are different variants this year than there were last year and the year before. And that COVID vaccine that is available right now, it's a different strain targeted to the COVID variant that's circulating right now. So number one, that's one reason to make sure you get the updated vaccination. The other reason is because immunity wanes. So whether you had COVID 6 months ago, whether you had a COVID vaccine a year ago, that protection fades over time. And we know both from infection or from vaccination, it gives you the strongest immunity about 4 months after that infection or vaccination, and then it really starts to taper off. So even if you had COVID last year, even if you had the vaccine last year, that immunity has started to fade. And so those are the 2 reasons why I recommend getting a COVID booster every year.
That's important to know because people think that they've had a shot and it's going to protect them, or if they've had COVID, that they're protected. They won't get COVID again, but that's not true at all.
That is not true at all. There are some vaccines out there that do offer lifelong immunity. There are some vaccines that prevent all cases of a certain disease. COVID is a little bit different. It doesn't protect against all cases. What it does is it protects against the severe outcomes, and it doesn't last forever. So until we get a vaccine that lasts forever for this particular disease, it's important to stay up to date with your shots.
What about masks?
We know that masks work. And in fact, when I'm in the hospital and when I'm taking care of a patient with COVID, for example, I am counting on my personal protective equipment. And in fact, when I'm with a patient who I know has COVID, someone who's coughing and is quite sick, it's really important that I'm wearing a well-fitting mask, and I even wear eye protection. And we know, in fact, we've got decades of experience dealing with things like influenza, with COVID, with RSV in the hospital, showing that that personal protective equipment really works. Now, it's more difficult to wear personal protective equipment when you're out and about in your daily life. You may not want to wear a mask when you're out grocery shopping or socializing with friends. But what you really want to do is layer your protection. So getting that vaccine is one layer of protection. Making sure that you're getting enough sleep and having a healthy diet and just taking care of your general well-being, that's another layer of protection. And then if you happen to be traveling or going to a big gathering where you know there may be people who are ill, and if you want to wear a mask as an extra layer, you can. If you want to carry a little bottle of hand sanitizer and make sure you're sanitizing your hands, you can do that as well. It's all about what is comfortable for you. Now, I used to wear masks on planes. I have stopped wearing a mask, but I carry that little bottle of hand sanitizer, and not only am I sanitizing my hands, I'm actually sanitizing the things
area,
around me, especially that screen when I'm traveling on an airplane. So whatever feels comfortable to you. But again, making sure that you're vaccinated is that first level, that first layer of defense.
Are people more susceptible to attracting and getting COVID if they're indoors or outdoors, or does it matter?
We know that air quality and air ventilation is really important. So you're, of course, at less risk of exposure if you're in an outdoor or really well ventilated space. If you're in a crowded situation, if you're in a poorly ventilated space, those droplets can hang around in the air for longer, and again, that can risk an increased exposure.
Is it just as contagious as it was initially?
It is. It is just as contagious, but what's different is we are different. We're not the same folks that we were in 2020 who had no immunity at all to the virus. All of us now, for the most part, about 98 to 99% of the population have some level of immunity because all of us by now have either had at least one vaccination or at least one infection with COVID. And so we're a little bit better protected than we were back in 2020. But if you want to avoid the severe complications, making sure that you get that annual booster is one way to ensure your safety.
And are those vaccinations still free?
Well, it really depends on a few factors, but those vaccinations are still covered by insurance.
Okay.
They're still covered by private insurance, by Medicare, by Medicaid, without cost sharing. So it still should be fairly easy for you to get a vaccine for free if you have any of those types of insurance. And for your viewers, many of whom are over the age of 65, again, it's a little bit easier this year in 2025 than it is for some younger folks to get the vaccine.
Thank you for that. Okay, let's shift a little bit now and talk about flu and our RSV. Flu shots, COVID shots, RSV, should they get all of those?
I would recommend all of them. Now, the difference is flu and COVID we recommend every year. RSV right now is a one-time thing. Now, it may be that as we learn more about it, we may recommend getting another vaccination at some point in the future. But I do recommend getting protected from all of those viruses because we know that those are sort of the big three when it comes to our seasonal respiratory viruses, the big three that can make you sick and that can even put you in the hospital.
Explain to our audience exactly what RSV is, and then following that, how do you know if you have COVID or you have the flu? What are some of the symptoms for each?
So RSV stands for respiratory syncytial virus. It is another respiratory virus. It's passed the same way that these other viruses are passed. So it can be droplets in the air, it can be through contaminated surfaces, and it causes respiratory distress. And in little ones, in babies, especially babies who are going through their first cold and flu season, it can cause what we call stridor, or really difficult breathing that can be hard to watch. And then in older adults, it can also cause significant breathing problems. So when we think about RSV, we especially want to protect pregnant moms, babies, and older adults.
And the vaccine will help with that.
Exactly, yes. Again, the vaccine may not protect against a mild case, but what it will do is hopefully keep you out of the hospital, prevent those severe complications.
And people, if they have any other existing conditions, that could even compound RSV even more. If they have diabetic or if blood pressure or other kinds of issues going on, any kind of respiratory issues whatsoever, correct?
Absolutely. If you're someone with COPD, for example, with existing lung disease, we know that respiratory viruses can be particularly hard on you and can actually lead to your underlying respiratory disease getting worse. And those are the folks that I really worry about and that I often see in places like the ICU.
Okay, so if I have a headache, achy body, I don't feel well, how do I know if I have the flu, if I have COVID, or if I have RSV, and what do I do?
It can be hard to tell. Influenza and COVID can cause fairly similar symptoms. You can feel very run down, you can feel achiness, you could have a little bit of a fever, and you can have those respiratory symptoms. And so the best way to distinguish between them, instead of trying to guess, is to get a test. And the good news is we've got combination tests that are available now. So you can go to a pharmacy and you can get a single test that will test COVID and influenza.
Oh, nice.
And if you test negative for both of them, then there are about 200 other different virus subtypes that circulate at this time of year. So just because it's not flu or COVID, it doesn't mean that you don't have a virus. There are so many other things that can make you sick. and we still want you to keep those germs away from other people. So I still recommend, if you're feeling unwell, staying at home, even if you test negative for both flu and COVID.
And how long should you isolate yourself?
Really, rule of thumb is until you're feeling better, until you're on the mend and have been on the mend for at least 24 hours. Because, you know, if you are still having a fever, for example, you could still have some virus particles that you're sort of putting out into the air. And if you've been not only recovering, but recovering for about 24 hours from any of these viruses, chances are that viral load is much lower.
And how long like, let's take COVID, for instance. How long, 3 days, 5 days, that you would actually feel symptoms, or does it change with each person?
It is different for everyone. Okay. You know, we have folks who have COVID who are completely asymptomatic and said, I never felt a thing. We've got folks who get COVID and then they are, you know, coughing and feeling miserable for a week, and having a residual cough that lasts even longer. So it's different person to person. And, you know, that's why the rule of thumb is to really base this on your symptoms, especially if you have a viral infection and you're not sure which one it is. Again, for those people who test negative for COVID and flu, it's just important to stay at home, to take care of yourself. Right. Lots of liquids, take some time in bed, get some rest, get some sleep, and then stay away from others, again, until you're on the mend for about 24 hours.
Is there any type of over-the-counter medicine that you could take if you have COVID and or the flu?
There are lots of over-the-counter medications you can take for respiratory illness in general that could make you feel better. Now, the medications that can actually target the viruses, those are prescription medications. So we've got two antivirals, or we've got a few antivirals, but we've got antivirals for two of those diseases. We've got antivirals for COVID-19 and antivirals for the flu. So if you test positive for one of those viruses, you can talk to your doctor and take an antiviral specific for those illnesses. But if you're not sure what you have, you've tested negative for those two viruses, there are still some over-the-counter things that you can take to feel better. And I would recommend taking a pain reliever, anti-inflammatory, if you can, something like Advil. For folks who can't tolerate things like Advil, Tylenol is another safe option that can help with the achiness, the sore throat. There are some cough suppressants that you can take. There are some medications that thin out your secretions if you're coughing up a lot of phlegm. So there are things that can make you feel better. And I also recommend lots and lots of warm drinks.
So people don't know, that's excellent advice. It kind of goes back to the chicken soup, lots of rest and, and stay in bed, right? But people don't know. Sometimes they can't get the test, access to the test. So if they're feeling bad, what's the first thing they should do? Assuming they don't have a test or access to a test, they might live alone, can't afford the test. They used to be free. I know now there's a small charge for it. But what's the first thing they should do?
Well, you know, the first thing is if you are feeling so unwell that you're, for example, having a hard time breathing, or you're developing some concerning symptoms, you're feeling lightheaded, dizzy, you feel unsafe in any way, you've got to seek medical attention. So those are the things that you really need to go to an emergency department for. But otherwise, if you feel like you can control your symptoms, staying at home and keeping that virus away from other people is really the first thing we want you to do, whether that's from people even who live with you, staying in one room and trying to minimize contact with them, or if it's avoiding spending time out in public, you don't want to take that virus to the grocery store or to your place of work. You don't want to expose other people.
So we have about a minute and a half or so left. You're an infectious disease doctor. What gives you pause right now? What's going on in our country, in our state, regarding our health care? What gives you pause? What I hate to see, and I don't like being negative, but I'm gonna be negative for a minute here, is the level of distrust that we're seeing between the public and public health, the way that the discourse has become so political around some of these things that are not at all political, the way that there is distrust of tools like vaccines.
And I'm sure some of your viewers can relate. Vaccines save lives. And when I talk to especially seniors and older folks about vaccines, I am really stopped in my tracks by some of the stories I hear. The stories of what life was like when polio was still circulating. The stories about what it was like when kids were still contracting measles every year. And some of the hardships that families and parents faced when these diseases were rampant. And I'm wondering if one of the ways we can combat this is by seniors sharing their stories. You know, one of the things that gives me a little bit of hope is our seniors are still getting their vaccines.
Yeah, which is great news.
Which is great news. You know, we've seen levels of vaccination decline in every age group except for our 65 and over age group. People are still getting their flu shot, they're still getting their COVID shots, and that makes me really happy. And I think partly it's because this is a generation that has seen the worst. It's a generation that has seen some of these illnesses. And so I would love it if seniors could share these stories with their kids and with their grandkids.
I appreciate that, and thank you. What makes me really happy is having you here sharing all this wonderful information. Thank you so much for being with us.
Thank you for having me on.
I'm Tracy Anderson with Impart Alliance at Michigan State University. Today I'm here with Jennifer Digman from Mount Pleasant. We're here to talk about direct care and the impact that it has on your life. Tell me about direct care and what it means to you, Jennifer.
It means so very much because my disease, multiple sclerosis, has made it possible for me not to walk. I'm having trouble with my hands, and that's the variability of multiple sclerosis. But direct care workers, they can come into my house, and depending what my needs are that day, they can help with everything from going to the grocery store or helping me. For heaven's sakes, Jen will take me to the post office so that I can mail letters, and if I need to go somewhere, that they can help. Jen can help with that. Or little things like cooking dinner so that Dan can have meals when he's done working, because my husband also lives with multiple sclerosis. And Jen not only cares for me, but she can help by making my life easier. It helps Dan, so his day-to-day existence is better. And direct care does that.
And direct care allows you to stay in your home, which everybody deserves.
Everyone deserves that, and everybody knows that waking up in your own bed and living your own home, it really makes your life so much more rewarding and fulfilling, and the way it should be.
Absolutely. Thank you. To learn more about Impart Alliance and our advocacy around direct care, please visit our website at impartalliance.msu.edu.
Dental hygiene is so important, but if you don't have good dental hygiene and you don't take care of your teeth, Dr. Skari, what can happen?
Well, not taking care of your teeth definitely leads to a lot of other issues. Apart from losing teeth to periodontal disease, which is one of the leading factors of why people lose teeth, is their gum disease. That has also been shown to coronary diseases, to heart disease, to Alzheimer's, and also to pulmonary diseases. So taking care of your teeth definitely should be one of the most issues that should be on our checklist when it comes to our yearly checkups, when it comes to our to do things, as we are aging,
right,
and as we are taking care of our health.
And how often should people visit the dentist?
A minimum twice a year, and some people need to see the dentist about 4 times a year. Depending upon their, of course, their problems. That is for just their checkups. When, of course, they have some other issues that need to be dealt with, they need to make sure that they are taken care of while the problem is still small,
right,
because, of course, the solution is going to be small.
And you talked about some major issues, coronary, Alzheimer's. A lot of older adults are suffering from those issues, and it could be because of their oral hygiene. Caregiving is an issue that impacts so many people throughout the state of Michigan, and it's a financial burden for a lot of them. Jason, what is the Credit for Caring or Michigan Credit for Caring Act, and how does it help caregivers?
Thank you, Paula. The Credit for Caring Act is a proposal that AARP is pursuing in Congress as well as in state legislatures across the country, including in Michigan. It would be a tax credit for caregivers to be able to apply for those out-of-pocket costs that they incur while caring for a loved one throughout the year. We know from AARP research that unpaid family caregivers incur more than $7,000 of out-of-pocket costs while providing that care. And we know from AARP research that caregiving is widespread. In Michigan alone, caregivers are estimated to provide 1.1 billion hours of care to loved ones throughout the year, representing a financial cost of $19 billion.
And they actually save the state money.
Yes, without unpaid family caregivers, the long-term care system would not be able to function. Caregivers are an invisible workforce holding up the long-term care system, but they are also a critical part of it because most older adults want to remain in their homes and they have better health outcomes when they do so.
And heaven bless the caregivers, because without them, people might not have the options that they're financially burdensome for people to go to long-term care institutions. So we want to do everything we can for caregivers.
Yes, we do.
Thank you, Jason. Appreciate you being here and all that AARP does for caregivers in Michigan. Dementia. People are talking about dementia. And today, we're going to ask Dr. Schaefer, what is dementia?
It's a super good question. I hear this a ton in my private practice or in my clinical practice. You know, my mom has Alzheimer's disease. I think she has dementia. And so differentiating that and making sure that we're using the same language is really important, if for no other reason that we can talk to each other and have a sense of where we're going and what we need. So dementia truly just means that you have experienced a decline in functioning. Wherever that baseline level was, wherever you were here, and for some reason, you're here and it's decreased, right? So there's a notable decline. And that dementia, to be defined as dementia, you have to have a deficit in memory, and then really there needs to be a deficit within another domain. So my memory plus, let's say, my reasoning skills, my frontal lobe, my problem-solving abilities. So dementia, again, is just a decline in functioning. So then, maybe a more important question is, what causes dementia? And for that, we know there are many, many types. Alzheimer's disease is probably the most prevalent. 60 to 70% of cases that go into specialists are ultimately going to be defined as having Alzheimer's disease. But there are dementias due to Parkinson's disease. There are dementias associated with Lewy bodies disease. There are dementias associated with alcohol, with vascular changes. So as our health changes in the United States, diabetes rates are up. We see conditions like vascular dementia rising.
So dementia is more of the umbrella term for all the other. Thank you, Dr. Schaefer. Appreciate you being here. Thanks for watching. Great information. Hopefully there was news that you can use. Be sure and share it with others. Thank you.
Promotional consideration paid for by the following.